Atrial fibrillation is a chaotic rhythm that occurs in the top chamber of the heart, where the top contracts in a disorganized manner to the bottom of the heart, which gives you a pulse rate of anywhere between 100 and 160 beats per minute. It typically causes symptoms of fluttering in the chest. It can cause you to be short of breath. It can cause heart failure. It can make you fatigued. And the concerns about that is that that can increase your risk of stroke and complications long term. The number one risk factor for atrial fibrillation is simply age. As we get older, we're more likely to have atrial fibrillation. Other common risk factors are obesity, obstructive sleep apnea, heart failure, coronary disease, high blood pressure. And sometimes there are reversible causes such as having thyroid abnormalities or drinking excessive amounts of alcohol or caffeine. We know that there's a smaller group of patients with atrial fibrillation who can have a familial history of atrial fibrillation, where they have family members that have had atrial fibrillation and there's no other cause of their atrial fibrillation. But most of the time, atrial fibrillation is caused either by age or other reversible health factors such as obesity, sleep apnea, heart failure, and coronary disease.
Live Healthy is sponsored by Grand Strand Health and provided as a service to you and your family.